Good morning, friends. For last 1.5 months, we have been discussing general pathology and we have completed cell, inflammation, immunity, genetics, neoplasia, infections, and many other important aspects. And now we are shifting our attention to systemic pathology and we will start with hematology. Good understanding and application of hematology needs clarity in fundamentals of physiological concepts, disease processes of red cells, white cells, and coagulation, lab approach to diagnosis, clinical features, and prognosis. Hematological processes are deranged in primary hematological disorders and also in disorders in which blood is affected secondary to some systemic disease. We will start on 8th of September at 7 p.m. with introduction to hematology and understanding of anemia. Looking forward to wonderful interaction with all of you. Have a good day.